When a person becomes an egg donor, the clinic that they're working with may require what is called a family risk assessment. Sometimes it's called a genetic assessment. And what this is just a phone call with a genetic counselor. So the donor agency that you're working with, they of course connect you with the genetic counselor that they work with. They support you in scheduling the appointment. And then again, it is a phone call that essentially just goes over your personal and family medical history. So during this call, our agency, we only connect donors with really great, kind genetic counselors that make the process as easy as possible. During this time, we advise the donor to have her donor profile with her so she can review all of the family health history that she included in her profile. And then the genetic counselor is going to ask about the overall health of the donor's parents, siblings, aunts, uncles, grandparents, if the donor has children, the health of the donor's children. They might also ask, specific questions such as, has anybody in the family ever had a miscarriage or, a disease such as Huntington's or cystic fibrosis. Usually, if that is the case, you would have already provided that information, but again, they will ask more specific questions as well. And so you provide all of this information. If you have already had your genetic carrier screening and you know if you are a carrier for certain gene mutations, the genetic counselor can help you understand those results and what it means for you and your future children. So it can be a really interesting, helpful call for you. After the call, the genetic counselor creates a report outlining, everything you talked about, and then outlining if there is any potential risk to future children because of the family health history. So for example, if your mother and her sister both had breast cancer, the genetic counselor then might recommend that you are tested for the breast cancer gene, or in some cases, they might recommend that a donor not move forward because of certain aspects of her family health history, which is, of course, disappointing, but that sometimes happens. So again, a pretty easy, straightforward call, nothing to be intimidated about. If you have any questions about this or any other questions about pregnancy, fertility, motherhood, let me know in the comments below. You can also email me directly at the email address provided in the video description.